Hello everyone. To Be or Not to Be is a video snippet which discusses some of the commonest and repeated questions which students have asked me about post-graduation and career during my journey of more than a decade as a teacher of psychiatry for entrance exams. Well, we all know life is a journey. As a student, you are on this journey and do reach points of decision making. One such important point of decision making is about post-graduation and career path. In this journey, uncertainties are the only certainty. We are all unique in our abilities, resources, vulnerabilities, and challenges. Remember, despite all the planning and preparation, things can turn the other side and test your resilience. So, as a student of medicine, what are the options you can consider? There are three simple options. First, an unusual and unexpected option, moving out of medical field. Second, practice and work with the MBBS degree. Third, a want or need to be a PG or a postgraduate. Let us take each of these three options and discuss further. Moving out of the medical field. It is important to remember, it is not a crime or failure to move out of medical field. We might not be cut out for medicine, or medicine might not necessarily be cut out for us. If it does not work out, do not be too harsh on yourself. When people move out of medical field, they might move into family businesses, corporate jobs in areas of interest, allied healthcare jobs, and of course, they can also become doctorpreneurs who have their own startups in their areas of interest. Talking about the second choice, significant population would start career with MBBS degree. Typical options sought are individual or clinic-based practice by setting their own setup and revolving their work as a family physician or a personal physician. This path can be slow, steady, and exponential in its growth. The major challenge for this path remains the mushrooming of specialty and super specialty centers, which can dent the practice in a significant manner. MBBS doctors can work in various setups, a private, a public sector, or a corporate company. They work as doctors on roll and continue a secured salary and sustained growth as per organization policies. Monotony, boredom, and stagnation could be the challenge here. MBBS doctors could get recruited into government services and serve the community at various levels, from grassroots level to policy making. Sometimes the growth could be quite slow or get stagnated, but people with abilities and tact can choose this area and grow to great levels. Coming to post-graduation as a choice, first and foremost clarity to have as a student is to find whether it is your need or want to do a post-graduation. So, is there a simple difference between need and want? Answer is yes. For example, oxygen is a need for survival, whereas an air conditioner is a want for survival. Ask yourself whether the choice of post-graduation is just a herd mentality. Is it like it has been drilled into your head that this is the only way out? Please remember, this does not undermine the choice of doing post-graduation in any way just because you follow what majority do. But it just means you need to find out your reason to do the post-graduation. Are you keen in pursuing post-graduation because you're passionate in a particular area, or you want to develop some focused skills in an area of passion and help community at large? Then go ahead and pursue the area of interest. Are you thinking of doing post-graduation just to get competitive edge and be future ready so that you can be employable and financially secure? Whatsoever be your reason to decide doing post-graduation, then the next question is to choose which subject. Preclinical, paraclinical, clinical are three important broad areas of post-graduation students think of. Things to keep in mind while choosing the subject are: do you already have a subject of passion or interest, a subject you want to spend rest of your life on? Then go for it. Do you like to work with specific population like children, women, elderly, or others? Pursue a post-graduation or super specialty which could help you to work in these areas of interest. Choosing a subject could also be based on the fact that you want to decide how you want to professionally shape your career. The kind of work you want to indulge in as a physician, surgeon, interventionist, diagnostician, or others. The kind of work-life balance you aspire for, whether you look to cater outpatient care, inpatient care, emergency care, rehabilitative care, and many other modes of healthcare delivery systems. Satisfaction, security, and finances you're looking from your career could also determine the choice of your subject. To summarize the idea of choosing a subject for post-graduation, there is no holy grail of choice system. You need to ultimately decide what you would like to do 5 years from now, 10 years from now, or many years from now. You need to be willing to keep tweaking your decisions and actions in time to come. Once you decide which subject of post-graduation, the story does not end. The next big challenge is where to do post-graduation. Does institution matter at all? The subject of choice gets you into a path. Institution or departments where you work gets you to deal with this path. The culture, the mindset, and exposure certain institutes can bring cannot be undermined. This is one of the main reasons why a lot of students pursue their career in central institutes. While choosing institutions, important aspects downplayed are the region, language, and accessibility. Please remember, doing post-graduation in a region, language, and culture you're comfortable with will make your PG journey a better quality. Choosing psychiatry as a career. The first and foremost I would like to clarify is psychiatry as a subject is as good as any other subject or as bad as any other subject. There are many students who have come across who have an aversion towards psychiatry. So anyways, they choose not to do psychiatry, so be it. There are some who have an inclination towards psychiatry, and I see a steady increase in the population of these who are inclined towards psychiatry. When I'm talking about an inclination towards psychiatry, it could be an instinct or an inner feeling to take up psychiatry. Some have had experience through their internships, postings, or media which makes them positively inclined towards psychiatry. A few students choose to consider psychiatry just because of curiosity of what it could be. They jump into the ocean of psychiatry. Of course, I have seen most of them swimming beautifully in this ocean of knowledge rather than getting drowned in it. Are there prerequisites to become a psychiatrist? Psychiatry, like any other branch, has no special prerequisites. So anyone with a positive intent should be able to succeed in psychiatry. Even if you feel there are areas of possible deficits, any skill can be learnt over a period of time. Only thing required is an open mind and willingness to learn. When it comes to potential, psychiatry or mental health in general has great potential in the current era. The demand and supply is ever increasing. The importance of seeking mental health professional help is on the rise. Mental health is a happening field in terms of research, academics, developments, and policy making. The possibilities of practicing psychiatrists are many. They could exclusively work in academic institutions, dealing with clinical work and research in tandem. Psychiatrists could be in forefront of government services, reaching out at the grassroots level and communities at large. Most states are working on district mental health programs seriously, hence creating opportunities for budding psychiatrists. Psychiatrists working in private space is quite common. They can focus on delivering outpatient or inpatient care or other forms of integrated care. One of the major differences of psychiatry from other clinical branch is the ability of a psychiatrist to start their own setups of small or big size, which is relatively easier in terms of investments and need of machinery. Practicing psychiatry at small towns is quite a possibility. In fact, the demand of psychiatry in small towns and rural population is exponentially increasing. Any branch can have its own pitfalls, and psychiatry has its own. Have you heard of the halo effect? The tendency for an impression created in one area to influence opinion in another area. The moment you utter the word "you are a psychiatrist," people react differently, sometimes positive, sometimes negative. Most of this reaction is based on their own myths, misconceptions, and beliefs. Hence, we need not get affected by them. Psychiatry as a career is financially viable. It is good to remember that the income could be average to above, but many times lesser compared to surgical or other intervention-based branches. Psychiatrists who typically pursue their own setups end up doing well on the long run. Serving in mental health is extremely satisfying. When you get lost in your profession and poor in your self-care, burnout is bound to happen in all fields, including psychiatry. One of the challenges to remember on the long run is as you become successful, you might be surrounded by more challenging, relapsing, and difficult to treat or manage patients, which sometimes can bog you down. But isn't it true for any successful professional in any other branch? One of the important points I would like to clarify here is the fact that many believe psychiatrists over years become crazy or they become mentally sick. Please do remember, there is no evidence to say that choosing psychiatry as a career has higher risk of specific mental health problems. Moreover, it is important to understand 1 in 4 adults can have mental health problems. As mental health problems are such common conditions, it could also affect vulnerable psychiatrists. Pursuing MD or DNB should not make a difference. The institution you choose could make a difference, especially for psychiatry. I'm not talking about the credibility of the institution, but the language and culture of the major patient population it caters. As being familiar with language and culture could be an additional benefit as a postgraduate. Super specialty and fellowships are mushrooming in psychiatry as in any other branch. As of today, it might not give additional weightage or value except in academic setups. It can be pursued based on one's own personal preference. For psychiatry, some of the important institutions considered are NIMHANS, AIIMS, PGI Chandigarh, CIP Ranchi, IBAS Delhi, and many other institutions. Other than these, every state has easily 2 to 3 particularly good medical college departments where psychiatry can be pursued. There are excellent DNB institutions to be considered too. The options are plenty. The willingness to take lies with you. Please remember, I have no personal recommendation about a specific college, as I believe for a sincere and willing student, any institution turns out an ocean to learn. Indian Psychiatric Society, Indian Association of Private Psychiatry, and other professional associations in India are continually active and strong with their academic events. Hence, irrespective of the place you start studying, you shall have access to best resources and people in due course of time of your learning. Before we wind up, there are some thumb rules useful to decide. Number 1, assign yourself time to collect unbiased information from all the accessible sources. Number 2, jot down all the available information into one single sheet without any prior judgment. Number 3, provide values to each of the data points collected. The values could be positive, negative, or neutral, where 0 is a neutral view about that point, -3 and +3 are extreme negative and extreme positive views about that data point. When you sum up and calculate, an answer will stare at you. The challenge will remain is, do you accept the answer? Get ready to embrace the uncertainty. Let me wind up with parting wisdom. There is no right or wrong decision. There is only one thing called decision. What we do after that decision shall prove the decision was right or wrong. Do not hold on to decisions, hold on to actions.